about, I'm running Winnipeg. You were saying that there's potentially like a interim, something else that dentists can do to sign up. Can you explain that a little more in detail?
Not yet. Soon. Yeah.
What the government should do to find an agreement with the medical associations?
Well, look, I respect the dental associations enormously. They're doing their job. They're negotiating. And they want to get the best deal for their members. I want to get the best deal for taxpayers. So there are a couple of red lines in that. One of the red lines for me is that patients aren't going to pay. There's a lot of providers who want patients to pay out of their own pocket. We can't do that. These are vulnerable people who can't afford to pay out of their own pocket. So that's a red line. But outside of that, on administrative burden, we set up a task group to really get that administrative burden down as low as it can possibly get. And for me, that makes the standard is for it to be identical to any other insurance process. Somebody can walk in, show their card, plug it in, they're going to be paid within 2 days. Make it a very, very simple, easy process. That's for over 90% of the cases. For the smaller number of cases that require pre-authorization, that's more complex care. We're also working through to make that process really simple, but we need to make sure that that work is needed. We can't just have no controls on it, otherwise somebody could abuse it, and we wouldn't want that, and we do have responsibility to taxpayers.
Why can't you give us a number, though, of how many dental oral healthcare providers have signed up? Like, that must be a number that you're tracking. Just
sure.
You're tracking the seniors that have signed up.
Yeah, so we are. There have been thousands. The part of the challenge is that we're working on this new portal. So I don't want to become too fixated on, because we're opening up a different channel, and I'll be in a position to talk about that different channel very soon. I don't want to get too fixated on one number when we're creating a second option. I can say that the conversations that I've had, I'm meeting, look, for the next couple of months, this is what I'm doing every day, is I'm talking with dentists, and I'm talking with hygienists, and I'm talking with denturists, and we're making revision improvement to the program, and I can tell every one of those conversations ends positively with an understanding that I think we're going to be able to see near full participation. That's my goal. So I think that working through these issues so that we can overcome the obstacles that are there, so that we have a program with as much uptake as possible, that's my goal. So because we have that alternative channel, I think it would be confusing to get into that number.
So, but we're only a few weeks out here.
Yeah.
Do you think that there's going to be enough oral healthcare providers to meet the demand of 1.6 million seniors who are already signed up? That's not even all the ones that you're going to have eventually.
Sure, we're going to have 9 million folks in the end, and this is the largest federal program in Canadian history. And I don't want to lead anybody astray. It's going to be a challenge to meet the entire demands of the population, and we always knew that. The goal here is not perfection, it's progress, and to move forward every day with more and more people being seen. Hundreds and hundreds of thousands of seniors are going to be seen in May. And my objective is to make sure that we do get everybody seen, and that we scale up the existing system to be able to metabolize the 1/4 of Canadians who have no oral health care. But that doesn't mean there's not going to be some bumps in the road. It's going to mean it's going to take us a little time to get to full rollout. But I think if we allowed that to discourage us, then we would never make progress. It's every person who gets seen for the first time, every person who has coverage who didn't have coverage before is victory. And the key is to build every single day towards full coverage.
Should this be maybe a public system, not working within a private system, right? Like, I think that is a criticism too, is that
Sure.
Dentists are private practices. They get to set their rates if they want to. Should we have maybe looked at this differently and done it in a public forum, in the way that we take, we do hospitals, things like this?
Sure. I mean, maybe back in 1960, that would have been a great choice. When we began healthcare, if we had started with eye care and oral health and prescription medicine, that would have been one thing. But we built an entire infrastructure around the existing systems. So we have to work with what's there, and we need at pace to be able to get people covered. So it's logical to fill in the gaps and to go in the most efficacious and efficient way to create that. To rip it all apart, burn it to the ground and start something new, it just isn't particularly realistic, particularly when for 3/4 of the population, well, more than that, 75% of the population, you have folks who are happy with their existing coverage and are getting the dental care that they need. Really, our focus is on that 1/4 of Canadians who don't have coverage, and what's the fastest, most efficient way to do it, and that's the model that we've chosen.
You've done a contract with Sun Life to do this program. Are you happy with how they've been dealing with it so far? Because we've been talking about the dentist, but you also have this a private insurance provider that is helping you bring out this program.
Sure, I'll answer this, and then I got to get to question period. I apologize. But yeah, I think that this is a complex bit of business. You have the dental associations, provincial and territorial, who have a responsibility to negotiate, and rightfully are negotiating aggressively and trying to get the best deal for their members, and I respect that. We're working with Sun Life, who's our provider. We had an open competition to select who is going to be the provider. They've been doing a great job working with opposition parties around their concerns, seniors and constituents around their concerns, and trying to put all those things together to resolve them. But overall, it's working very effectively. Sun Life has been a great partner, and so too, frankly, have been the providers and the dental associations. Thanks so much. Appreciate it.
Sur les dépenses militaires, est-ce que vous croyez qu'on devrait couper ce qui a été annoncé aujourd'hui? Qu'est-ce qu'on devrait faire?
Couper ce qui est annoncé?
Oui, est-ce que c'est...
Ce qu'il faut faire, premièrement, c'est de couper. Si on veut faire des économies, il faut aller chercher 21 milliards donnés à des entreprises de consultants qui servent à presque à rien, vu qu'on a 100 000 employés de plus à la fonction fédérale.
Aujourd'hui, on les garde.
Est-ce que vous pensez qu'on veut couper en défense?
Je vous pose la question, c'est vous l'élu.
Non. Écoutez, c'est sûr que là, les annonces, je n'ai pas vu tous les détails, mais je sais qu'il y a une orientation pour le Nord, ce qui est très important, donc on ne peut pas être contre ça. Maintenant, est-ce que c'est assez? Est-ce qu'il y a moyen de faire autrement? Il faut que je regarde davantage. Je n'ai pas fait le détail de ça. Mais pour nous, c'est important d'avoir une défense qui est plus forte.
Est-ce qu'on devrait aller au 2 de l'OTAN?
Le 2 c'est une cible, mais en même temps, il y a la façon de faire avec l'approvisionnement de défense. On a beaucoup de problèmes avec l'approvisionnement. On a beaucoup d'argent qui se gaspille parce que l'approvisionnement, on a un problème structurel en approvisionnement de défense. Tant qu'on ne réglera pas nos problèmes structuraux de contrats, de dépenses qui se font en supplément de ce qui devrait être, on n'avancera jamais. Donc, il y a ça à régler.
Pas pour tout de suite.
Le 2 c'est un objectif, mais il faut que ce soit bien fait. Je mets de l'argent pour de l'argent, c'est pas ça l'idée. C'est de mettre de l'argent, mais qu'on renforce adéquatement avec les budgets prévus. Merci.